Hello, this is Dr. Joe Garri from Mosa Plastic Surgery. Welcome to episode number 17 of the Surgeon's Corner podcast, a series dedicated to patient education on topics related to aesthetic plastic surgery. In this episode, we will continue our discussion on chin surgery with part 2 of our series, focusing specifically on chin implant surgery. This contrasts with the alternative procedure of chin osteotomy, which we covered in our previous podcast. In part 1, we explored genioplasty or mentoplasty, a surgical procedure designed to improve the shape, projection, and function of the chin. The chin plays a crucial role in defining the lower part of the face and contributes to the jawline, which extends from the chin to the angle of the mandible, located a few centimeters in front of the earlobe. We also discussed how a prominent square chin is often associated with a chiseled masculine appearance, while a well-proportioned, defined chin enhances the aesthetics of the female face. For patients experiencing chin asymmetries, inadequate chin projection, or an undesirable chin size, chin surgery or genioplasty provides an excellent solution. In our last podcast, we reviewed the two primary methods for chin surgery, chin osteotomy and chin implants. To recap, in our first podcast, we discussed chin osteotomy, a procedure typically performed through an intraoral approach. This technique allows for the precise repositioning of the chin bone, which is cut and then can be repositioned in all three dimensions. The bone is then secured in its new position with plates and screws. Additionally, it was mentioned that chin osteotomy can also be a reductive procedure. That is to say, it can be used to decrease the projection or width of the chin. This is to be contrasted to implant surgery, which will always lead to an increase in the size of the chin. By definition, chin implant surgery works by enlarging the chin. While less versatile than chin osteotomy, it remains an excellent option for certain patients, particularly those with underprojected or small chins. This episode will focus specifically on this alternative approach. Chin implant surgery, also known as genioplasty, mentoplasty, or chin augmentation, utilizes synthetic implants to alter the shape and/or the size of the chin. This procedure is commonly indicated for patients seeking correction of chin asymmetries or those desiring enhanced chin projection or width. The implants used in chin surgery are solid and come in a variety of sizes, shapes, and materials. They can either be prefabricated in standard sizes or custom-made using virtual surgical planning. In this fabrication technique, the patient's photographs and CT scan are uploaded into a computer system where a custom-fitted implant is designed to the specific desired dimensions. The designed implant is then 3D printed in the chosen material to be used. The material options typically include silicone and Gore-Tex, both of which have smooth surfaces, or MedPore, which has a porous surface that allows for soft tissue integration, thereby leading to improved implant stability. During the initial consultation, the surgeon will discuss with the patient the material options, shapes, and sizes, and make recommendations in order to help the patient achieve their aesthetic goals. While custom-designed implants, created through virtual surgical planning, are often more expensive, they offer the best fit and precision for achieving the ideal chin shape, particularly in cases of chin asymmetry. Chin implant surgery is an ambulatory procedure, meaning it doesn't require an overnight hospital stay. The surgery usually lasts between 1 to 2 hours and is performed under either IV sedation or general anesthesia. While implants can be placed through an intraoral incision inside the mouth, between the lower lip and teeth, most surgeons prefer making a small incision just beneath the chin in the natural crease that exists there. After the incision is made, the soft tissue covering the chin is gently lifted to create a small pocket into which the implant is placed. The implant may either sit passively in place or be secured using sutures or plates and screws, depending on the surgeon's preference and clinical judgment. Once the implant is positioned, the incision is closed and the procedure is completed. The recovery from chin implant surgery is typically short, with most patients experiencing only mild discomfort and swelling for a few days. If an intraoral approach is used, maintaining impeccable oral hygiene is crucial to prevent infection. As with any surgical procedure, there are some risks to be aware of. These include the usual concerns like anesthesia complications, bleeding, infection, and scarring. Specifically for chin implants, there is a small risk of nerve damage, leading to partial or complete numbness of the lower lip. This occurs due to the pressure or damage to the mental nerve, which provides sensation to the chin area. Fortunately, this complication is rare and typically resolves within a few weeks when it does occur. Another potential complication is implant displacement. This is more of a concern for patients who are involved in high-contact sports or activities that could lead to trauma to the face. However, this risk can often be mitigated by avoiding such activities during the initial recovery phase. In conclusion, although chin implant surgery is not as versatile as chin osteotomy, it remains a fantastic option for patients seeking chin enhancement in terms of size or shape. The procedure is well tolerated, provides permanent results, and offers patients with the opportunity to improve their facial aesthetics and boost their self-confidence. Thank you very much for your attention and time. Please feel free to visit our website at mosasurgery.com. That is MOSA surgery.com, or our YouTube channel at Mosa Surgery for audio and video versions of this podcast, as well as patient testimonials, photographs, and other educational material. Once again, this is Dr. Joe Garri. I'll see you in the next episode of the Surgeon's Corner podcast.